a big deal. It's how you're going to see for the rest of your life. When I was first training, we didn't have to have the discussions about intraocular lenses that we do today. When you have cataract surgery, we actually are removing your eye's natural lens and we're replacing it with intraocular lens. There's going to have to be a discussion and understanding the doctor and the patients which lens they're getting, because it's a big deal. It's how you're going to see for the rest of your life. A lot of the lens choices have to do with how you're going to see afterward in terms of wearing glasses. We can actually put a new lens in your eye that can make it so that you no longer have to wear those thick glasses. What a lot of these new technologies are trying to move toward is not only being able to see distance, but also not having to wear reading glasses. We don't have an ideal way to make that work that you can see near and far with no glasses. We have something called multifocal lenses, extended depth of field lenses, Monovision. All of them have some compromises. I am all about the quality of vision.